up until 8 p.m. last night, which is the usual cut-off time. We had 6 cases in hotel quarantine. And I want to stress that that's a very positive issue for us, that the hotel quarantine system is working extremely well. There are also the 3 cases that we, as a matter of giving public health notices yesterday, talked about. There's the gentleman who was driving the airport van from Sydney Ground Transport. And of course, he's driving airport airline crews back and forth. And then there were 2 other people, a lady in her 60s and a gentleman in their 70s, in his 70s, from the Northern Beaches. So those cases, of course, are now included in today's figures. What we also have had to announce this morning as a result of further work by our incredible tracing team here in New South Wales is that there are other cases. This morning we have announced earlier 2 cases. One of those cases was I think a woman in her 50s, and she is a worker at an aged care facility. That aged care facility is the Pittwater Palms at Avalon. And we also announced this morning that there was a gentleman in his 60s who we have not announced, but I am now announcing that he lives at French's Forest. So it's obviously further down the Northern Beaches Peninsula, on the southern end of the peninsula. He has tested positive and been advised today that he has tested positive, and of course is now doing the 14 days self-isolation. In addition, beyond what we announced this morning, it would appear that there is now also a further case, which is a partner of the lady in her 50s. So they reside together. I understand initial information is that's also in the Palm Beach area. The gentleman from French's Forest has, I've got to say, the New South Wales tracing and tracking of our health teams is just incredible. Just in this last few hours, they've taken histories and managed to work out that this particular person has been working in a band. Interestingly, the band is called Nothing Too Serious, so that's certainly, from our point of view, I wouldn't say it's exactly how we feel, because it obviously is serious, but we are making every effort to do what New South Wales does extremely well, and that is to keep it all in perspective and just deal with what is coming our way at the moment. He has travelled extensively, and I'll ask Dr. Chant in a moment. He's worked at everywhere from Penrith RSL to Avalon RSL and other places, including, I think, the Kirribilli Club. But I'll leave that to her to go through some of that information. I think that it's fair to say that the New South Wales Health has already worked out some connectedness, which I'll leave Dr. Chan to talk about. And I want to thank again our gold standard tracing team for the work they've done. I think that we are moving very fast to establish all the various locations and connections, and have already worked out connections between the various people that we know have it. There are still issues to be sorted, but I expect that they will be sorted.